Good morning, everyone. I am Miss Limpahan, and for the continuation of communicable disease prevention and control, next would be the diphtheria. So, diphtheria is commonly caused by Corynebacterium diphtheria. It is acute febrile infections of the tonsil, throat, nose, larynx, or a wound marked by a patch or patches of grayish membrane from which the diphtheria bacillus is readily cultured. Nasal diphtheria is commonly marked by one-sided nasal discharge and excoriated nostrils. Non-respiratory or cutaneous diphtheria appears as localized punch-out ulcers. So the source of infections of diphtheria is discharges and secretions from mucous surface of the nose and nasopharynx and from skin and other lesions. For the mode of transmission, it transmit through the contact with the patients or carrier or with articles soiled with discharges of infected persons. Also, sa baby, milk has served as a vehicle. And then method of prevention and control, active immunization of all infants, 6 weeks, and children with 3 doses of diphtheria pertussis and tetanus toxoid administered of 4 to 6 weeks interval, and then booster doses following year after the last dose of primary series and another dose of the 4th or 5th year of age, and then pasteurization of milk, education of parents, and then also reporting of the case to the health officers for proper medical care. Then public health nursing responsibilities, carry on continuous preventive education in the community to maintain a high level of immunity with emphasis on the infant and preschool age groups, and then also observe correct technique for taking nose and throat cultures for diphtheria, and as well as teach procedures of disposal by burning of nose and throat discharges and eaten food as concurrent disinfection, and also encourage early prophylactic immunization of infants and children. For the nursing care, follow prescribed dosage and correct technique administering antitoxin infection. Also provide comfort of the patient should always be mind, and the OB bag setup should be outside the room of the patient, be far from the bedside of the patient, and a separate set upon a paper towel, as in temperature taking may be brought and placed on the bedside table or chair para not to maintain the sterility of the OB bag. Next is whooping cough, also known as pertussis or 100 days cough. It is an infection caused by Haemophilus pertussis or Bordet gengo bacillus or Bordetella pertussis or pertussis bacillus. So it is a acute infection of the respiratory tract. It begins as an ordinary cold, which in a typical case becomes increasingly severe, and after the second week is attended by paroxysm of cough ending in a characteristic whoop as the breath is drawn in. Then vomiting may follow spasm. Cough may last for several weeks and occasionally 2 to 3 months. For the source of infections of pertussis is discharges from laryngeal and bronchial mucous membranes of infected person. For the mode of transmission, it transmits through direct spread through respiratory and saliva contacts. Crowding and close association with patients facilitates spread. For the method of prevention and control, routine DPT immunization of all infants, which can be started at 1.5 months of life and given at monthly intervals in 3 consecutive months. This constitutes the primary injection. Booster dose is to be given at the age of 2 years and again at 4 to 5 years of age. Next is tetanus neonatorum or tetanus among older age groups. It is caused by tetanus bacillus or Clostridium tetani. It is a acute disease induced by toxin or tetanus bacillus growing anaerobically in wounds and at site of umbilicus among infants, characterized by muscular contractions. Sources of infection Immediate source of infection is soil, street dust, animal or and human feces. For the mode of transmission, usually occurs through contamination of the unhealed stump of the umbilical cord among infant, and then incubation period varies from 3 days to 1 month or more, falling between 7 and 14 days in high proportion of cases. And then for the method of prevention and control, pregnant women should be actively immunized in regions where tetanus neonatorum is prevalent. So health education of mothers, relatives, and attendants in the practice of strict aseptic method of umbilical care in the newborn. Health nursing responsibilities: report immediately to physician, including case history to determine in circumstances of injury, especially competence of attendant at birth. Next is influenza, commonly known as the flu. So it is a acute, highly communicable disease characterized by abrupt onset with fever which lasts 1 day to 6 days, chilly sensation or chills, aches or pains in the back and limbs with prostrations. Respiratory symptoms include coryza, sore throat, and cough. For the source of infection is discharges from the mouth and nose of infected persons. For the mode of transmission of influenza is direct contact through the droplet infection or by articles freshly soiled with discharge of nose and throat of infected person. It is airborne. As for the pneumonias, it is an acute infectious disease of the lung usually caused by the pneumococcus resulting in the consolidation of one or more lobes of either one or both lungs. Majority of cases due to Diplococcus pneumonia, occasionally pneumococcus or Friedlander. The signs and symptoms of pneumonias are rhinitis or common cold, chest indrawing, rusty sputum, productive cough, fast respiration, high fever, vomiting at times, convulsions may also occur. When the pneumonias are left untreated, complications may be the emphysema or pleural effusion, endocarditis or pericarditis with effusion, pneumococcal meningitis, otitis media in children, hypostatic edema. And as for the management for the pneumonia, first is bed rest and then adequate salt, fluid, calorie, and vitamins intake. And next management is tepid sponge for fever, and then frequent turning from side to side, and also the antibiotics based on care of acute respiratory infection of the Department of Health. Next is cholera, commonly caused by Vibrio Eltor. It is an acute serious illness characterized by sudden onset of acute and profuse colorless diarrhea, vomiting, severe dehydration, muscular cramps, cyanosis, and in severe cases, collapse. The sources of infection of cholera are the vomitus and feces of the sources of infections of cholera are vomitus and feces of infected persons and feces of convalescent of healthy carriers. Contact may be temporary carriers. Mode of transmission: food and water contaminated with vomitus and stools of patients and carriers. Method of prevention and control: first is report case at once to health officers, and then bring patient to hospital for proper isolation and prompt and competent medical care. And then other general preventive measures are the same as those of typhoid and dysentery. As for the public health nursing responsibilities, first is assess the family and patient to make arrangement for immediate hospitalization, as well as give necessary measures to control spread of the disease, and share with the patients and family the nature of the treatment, rehydration or replacement of lost fluids and electrolytes. As for the typhoid fever, it is commonly caused by Salmonella typhosa or typhoid bacillus. It is a systematic infection characterized by continued fever, malaria, anorexia, slow pulse, involvement of lymphoid tissues, especially ulcerations of Peyer's patches, enlargement of spleen, rose spot of trunk, and diarrhea. Many mild typical infections are often unrecognized. A usual fatality of 10% is reduced to 2 to 3% by antibiotic therapy. So the source of infections are the feces and urine of infected persons. Family contact may be transient carrier. Carrier state is common among persons over 40 years of age, especially females. For the mode of transmissions of typhoid fever are a direct or indirect contact with patients or carrier. Principal vehicles are food and water, and then contamination is usually by hand of carriers. Flies are vectors. For the method of prevention and control of typhoid fever, same preventive and control measures in dysentery, and in addition, immunization with a vaccine of high antigenicity. Education of the general public and particular the food handlers. As for the bacillary dysentery, also known as shigellosis, it is commonly caused by 27 serotypes of germs Shigella or dysentery bacillus. It is an acute bacterial infection of the intestine characterized by diarrhea, fever, tenesmus, and in severe cases bloody and mucoid stools. Patients with mild undiagnosed infections have only transient diarrhea or no intestinal symptoms. As for severe infections are frequent in infants and in early debilitated persons. Sources of infections are the feces of infected persons, many in apparent mild and unrecognized infections. For the mode of transmission, first is eating contaminated food or drinking contaminated water or milk, and by hand-to-mouth transfer of contaminated materials by flies, objects soiled with feces or a patient. For method of prevention and control, sanitary disposal of human feces, and also sanitary supervisions of processing, preparations, and serving of food, particularly those eaten raw. And then adequate provisions for safe washing facilities, and then fly control and screening to protect foods agents, fly contamination, protection of purified water supplies, and construction of safety and control of infected individual, contact, and environment, as well as reporting to local health officers. For public health nursing responsibilities, encourage medical care for any case of diarrhea, and then obtain stool specimen from any person found with undiagnosed diarrhea, and request examination for pathogens, and then also instruct the patients and family on procedures of proper disposal of human excreta. Next is soil transmitted helminthiasis. So soil transmitted helminthiasis is the third most prevalent infection worldwide, second only to the diarrheal diseases and tuberculosis. It is ranked 10th among the world top 10 infectious disease killer according to the WHO report in 1996. And then for the signs and symptoms, first is anemia, malnutrition, stunted growth in height and body size, decreased physical activity, impaired mental development, and school performance. And then prevention and control. First is health education. The community health nurse gives health teaching on good personal hygiene, thorough washing of hands before eating and after using the toilet, keeping fingernails clean and short. Next is paragonemiasis. So paragonemiasis is a chronic parasitic infection which greatly reduces human productivity and quality of life. Spotty in occurrence, it is frequently encountered in communities where eating of fresh or inadequately cooked crabs is practiced. The manifestations closely resembled BP, that most often it is misdiagnosed for this disease in endemic areas. As for the mode of transmission, first is ingestion of raw or insufficiently cooked crabs, contaminations of food or utensils with metasaccarides during food preparation. Next is hepatitis A. It is an infectious liver disease caused by hepatitis A virus. So it is a form of acute hepatitis occurring either sporadically or in epidemics and caused by virus introduced by fecally contaminated water or food. Young people, especially school children, are most frequently infected. So the predisposing factors are poor sanitation, contaminated water supplies, unsanitary method of preparation and serving of food, malnutrition, as well as disaster and work time conditions. As for the prevention and control of hepatitis A, first is ensure safe water for drinking, sanitary method in preparing, handling, and serving food, as well as proper disposal of feces and urine. Next is paralytic shellfish poisoning. So it is a syndrome of characteristic symptoms, predominantly neurologic, which occur within minutes or several hours after ingestion of poisonous shellfish. So the causative organisms are single cell organisms called dinoflagellates. Mode of transmission of paralytic shellfish poisoning: ingestion of raw or inadequately cooked seafood, usually bivalve shellfish or mollusks during red tide season. The signs and symptoms are numbness of face, especially around the mouth, vomiting and dizziness, headache, tingling sensation, paresthesia, and eventual paralysis of hands and feet, and then floating sensation and weakness. So the management and control measures are no definite medications indicated for the paralytic shellfish poisoning, and then induced vomiting. Next is leptospirosis. Leptospirosis, also known as Wills disease, mud fever, trench fever. So leptospirosis is a worldwide zoonotic disease caused by bacteria called Leptospires, Leptospira interrogans. So this species is divided into more than 200 serovars with var. Hemorrhagia thought to be more virulent and more likely to cause Wills disease, a severe form of infection. The common cause of leptospirosis is Leptospira interrogans. For the mode of transmission, it transmits through contact of the skin, especially open wounds with water, moist soil, or vegetation contaminated with urine or infected host. For the signs and symptoms, so there are two clinical phases. Manifestations are varied in different degrees of severity. So first is leptospiremic phase. Leptospiremic phase is leptospires are present in the blood and cerebrospinal fluid. Onset of signs and symptoms are abrupt with fever, headache, nausea, vomiting, cough, and chest pain. Next is immune phase. It correlates with the appearance of circulating. So that for the treatment, there are three medications such as the penicillins, tetracycline, and erythromycin. For the prevention and control, first is improve education of people at particular risk. Samples are farmers, miners, and etc. to increase their awareness and enable early diagnosis and treatment. Next is use of protective clothing, boots, and gloves, especially by workers with occupational hazards.